Hi, I'm Kate Baumiller. I'm a retired psychiatric nurse practitioner, and I've also had rheumatoid arthritis since 1987. So I've had lots of experience with how to talk to healthcare providers from both sides of the desk. Here's our disclaimer, and welcome to World Autoimmune Arthritis Day. The most important thing for you to remember is that you are a member of your healthcare team. You need to be able to work with your doctors, nurse practitioners, physician's assistants, and make sure that they understand you play a role. The first thing we need to figure out when we see a healthcare provider is what kind. Everybody needs somebody for primary care, whether it's a doctor, a nurse practitioner, or a physician's assistant. They can take care of all your general medical needs from cradle to grave. But if you have an autoimmune arthritis, you need a specialist. A rheumatologist is a doctor who specializes in autoimmune arthritis type diseases. Make sure you look for one who is board certified. Board certified means they have extra training in the field that they have chosen to specialize in. That way, you know you're getting an expert. Unfortunately, with these diseases, we need to see other specialists. You might at some time need to see an orthopedic doctor or surgeon. These doctors specialize in diseases of the bones and joints, and they perform things like joint replacement surgeries and treat fractures. If you have a disease like lupus, you might need to see a neurologist. A neurologist specializes in treatment of the nervous system and can help you with any problems you might be having with that. If you have psoriatic arthritis or certain types of lupus, you may need to see a dermatologist. They specialize in treatment of skin conditions and can work along with your rheumatologist to help you manage these problems. Unfortunately, with these diseases, we may often have to see a cardiologist. We know that inflammation plays a role in autoimmune diseases, and inflammation also plays a role in many heart diseases, including heart attack. If you need to see a cardiologist, don't be surprised. Certain kinds of medications that we might be on, or certain autoimmune diseases like lupus, might require that we need to see a kidney specialist. They're known as nephrologists. You may need to see an ophthalmologist. This is an eye doctor who specializes in eye diseases. Not the same thing as an optometrist. An optometrist may be able to diagnose an eye disease, but their specialty is helping you with fittings for your glasses and contact lenses. Because of the medications we're on, like prednisone and Plaquenil, or because of the diseases themselves, we should have regular eye exams with an ophthalmologist. What do you need to know before your appointment? If you haven't seen this particular doctor before, it's good to ask family and friends for recommendations for a doctor that they like. It's also good to write down a short list of your concerns. 3 or 4 is a good number. Make sure you bring your concerns up early. Don't wait till the end of the appointment when the doctor may not be able to sit down with you and give you the time you need to answer your most important questions. When I was practicing, I like to have my patients bring all of their medications with them and then sit down and explain to me exactly how they took them. There were many times we found that they were making errors in how they were taking medications. If you're not able or willing to do that, at least bring a medication list with you. And it's good to keep one in your wallet or your purse at all times. You never know when you might have a medical emergency and need that information. If you're comfortable, bring a family or friend to be an extra set of ears. Sometimes we get so caught up in the appointment we don't hear everything that's said. They can take notes or ask questions that you might forget. What else to bring to appointments? Well, it's good to bring lists. So medication lists. Make sure that you have all the over-the-counter medications that you might be taking, especially if you're taking pain reliever medications, because some of the prescribed medications may overlap with what you're taking over the counter, and your provider needs to know that. Don't be afraid to bring up herbals, vitamins, or supplements with your doctor. Just like medications, these can interfere or interact with other medications that we prescribe, so they need to know that. If you're using complementary therapies, you should be able to bring that up with your doctor too. Many people use massage or acupuncture or other type therapies to help them deal with chronic autoimmune illnesses. The doctor will ask you about your habits, things like what you eat, whether you exercise and how often, if you smoke cigarettes, and even if you quit smoking, when did you last smoke and how much did you smoke while you were smoking? If you drink alcohol or use street drugs, please tell your doctor. It might be embarrassing, but we need to know what habits you have that might interfere with the treatment plan that the doctor has for you. It's good to have a list written down of your current or previous healthcare providers, including phone numbers, any surgeries you've had, any hospitalizations, and your allergies. It's hard to remember all these details during an appointment, so it's good to have it written down. The doctor will ask you family medical history. They'll want to know things like heart disease, cancer, and even autoimmune diseases in your family. Before you go to your appointment, sit down and think about the symptoms you want to talk about. Things like pain and fatigue mean different things to different people. What exactly are your symptoms? Are they the kind of symptoms that are present all the time, or do they come and go? If they come and go, then when do you notice them? Mostly in the morning? More in the evening? Before exercise or after activity? Have you found anything you can do to make the symptoms better? Make sure the doctor knows about that. And also, what seems to make it worse? You want to make sure the doctor understands how this disease affects your daily life. Can you dress yourself? Can you do your daily chores? Are you able to go to work anymore? Those are important facts to bring up during your appointment. Again, have questions written down for your provider. You might ask them how they feel about involving your family in your care. This is important when you have an autoimmune disease because there may be times when you don't really feel up to talking with the doctor, but you want to have a family member represent you. Or you may want to take a family member to an appointment because they don't really understand your disease and may be questioning some of your activities or treatments. And you want to include them in that appointment. Ask your doctor whether or not you can email them or their staff if you have questions, or whether you should call. Some doctors charge for telephone time. It's good to know that. If you're using complementary treatments, you should talk to your doctor about what they believe about those. There may be certain treatments that they don't approve of, but they should be able to give you a reason why. If the doctor's ordered a test, you want to know why is the test being done. What do they expect to find out as a result of this test? You also want to know if there are certain things you need to do to get ready for the test, things like fasting or staying away from certain foods. Certain tests may have dangers or side effects or might require things like starting an IV. You need to know that as well. It's good to ask the doctor how you'll find out about the results. How long does it take and how will you be notified? You may expect results the same day, but not get them for several days, and that will cause you to worry unnecessarily unless you know in advance. It's also good to know what you'll find out after the test. For example, if you take an RA test, does that mean you have RA if it's positive? Or is that just part of the overall picture of diagnosing you? If you're given a new diagnosis, or even if you don't understand your old diagnosis, you might have questions about that. You might want to know what caused this condition. With many of the autoimmune diseases, no cause is really known. Ask the doctor whether or not they think the disease will be permanent. And ask them the whole picture of how you manage or treat such a disease. Does it require medication? Will it require a change in your lifestyle? What will be the long-term effects on your life? Ask them if they have any reliable sources on where you can learn more about information about your condition. There are many websites out there. Not all of them give you the most reliable information. Your doctor should be able to name 1 or 2 sites that you can go to. If you're a young woman and you're thinking about getting pregnant, that's a good time to bring up the pregnancy questions while you're seeing your doctor. You're going to want to know how this condition affects pregnancy, or in some cases, how does pregnancy affect the condition? This may affect how soon you start certain treatments. If you started on a medication, you should always know what the purpose for the medication is. Some medications may take a long time before you see benefits, and you want to know how long that's going to be, because it may be that you're having side effects before you have benefits, and you're ready to give up on the medication before we even know if it's going to work. You need to know specific instructions on how to take the medicine. Should you take it in the morning? Take it at night? Do you need to take it with food? Are there certain things that interact with this medication? We know now a lot of medications interact with grapefruit juice. So that's just one of the things that you might want to know. With the autoimmune diseases, some of our medications have to be stopped if we become ill with a flu or a cold or an infection, or maybe before a surgery, or if we become pregnant. We need to know how to tell if we need to stop the medication and when we can restart it. You should know what to do if you miss a dose. In some cases, you can take the medication right away. In some cases, the doctor is going to want you to just wait until your next dose is due. You might want to ask the doctor about other treatments, things like exercise. Water exercise is especially good for people with joint disease, and range of motion exercises may be required. You may ask about dietary changes or if weight loss might help. It's good to get referrals to physical or occupational therapy, especially if you're already having physical changes in your body. Most towns have a support group, but if it's not available in your town, you can find one online. Some people benefit from seeing a pain therapist. Ask your doctor for a referral. The doctor may recommend things like braces or the use of ice or heat. You may want to know if massage would be helpful, or what about acupuncture. Ask the doctor what they would like you to do if you have an emergency. Some doctors want you to go to the emergency room. Some will want you to call their office. If you want a second opinion, bring it up at your appointment. The doctor should be willing to give you a referral and not feel threatened. Always walk out of the door with written information. If they have pamphlets or information about your condition, be sure and ask. You might want to know how often you're going to need to be seen. Usually you'll have to be seen more frequently early on in the course of a disease, and once things are under control, you can be seen less often. You may ask the doctor if there are certain symptoms or problems arise that should require a call from you to his office. After your appointment, ask yourself these questions. Did the provider give me a chance to ask my questions during the appointment? And did I feel like they were really listening to me? Could I understand what they were saying? Was I comfortable asking him or her the questions? Your answer should be yes. You may be willing to give the doctor 1 or 2 more tries to see how they do if your answers are no to these questions, or it may be time to seek another provider. This information for this talk was adapted from the NIH Guide, a guide for older people how to talk to your doctor. For further information, you can look online for this guide. Thank you for your time and attention.